The next speaker is Dr. Paras.
Okay. Good afternoon, all. So, my study is about the unique features of optic disc melanocytoma on multicolor imaging, non-conflicts of interest or financial disclosures. Optic disc melanocytoma is a unilateral, deeply pigmented variant of melanocytic nevus. Classically involves the disc with contiguous involvement of the retina and choroid. A stationary benign tumor. Visual impairment is usually not significant. It involves the optic disc solely in 15% of the cases, underlying choroid in 54% of the cases, and can involve the surrounding retina in 30% of the cases.
How can
The
we?
local complications noted are disc edema, infraretinal edema, focal hemorrhages, vitreous seeds, RVOs. Enlargement can be noted in 10 to 15% of the ODMs. The risk factor is the initial thickness of 1.5 at the first diagnosis. So it's a retrospective study regarding the ocular imaging in optic disc melanocytoma patients. Ethical approval was obtained and written consent was taken from all the patients. The following details were noted in all the patients: the demographic data, the best corrected visual acuity, complete ophthalmic examination, and ocular imaging was done using Topcon fundus photograph, which recorded the conventional fundus photo, and multicolor imaging and OCT scans were recorded using Heidelberg spectralis machine. The images obtained through conventional fundus photograph and MCI were then analyzed and compared. So, coming to the result, 7 eyes of 7 patients who were diagnosed with optic disc melanocytoma were included in our study. The female to male ratio was 5:2, and the range of age was 32 to 64 years. 6 out of 7 patients had a best corrected visual acuity of better than 0.3 logmar, and only one patient had a diminution of vision with best corrected visual acuity of 1.8 logmar. So, coming to the unique features that we noticed on the MCI compared to the conventional fundus photo, as you can see, this is a 32-year female patient with best corrected visual acuity of 20 by 20 presented to us with elevated pigmented lesion on the optic nerve diagnosed as optic disc melanocytoma. The multicolor images shows different shades of red, as you can see, darker in the center, and as you go up in the periphery, lighter in the periphery. So this is nothing but on 3D reconstruction of the image of the OCT. You can see that darker the shade of the red is, the more the height of the tumor is. So basically, MCI being a two-dimensional image still is equivalent to a stereoscopic 3D image, because the darker the shade of the red that we see on the MCI, the more is the height of the tumor. Similar shades of red were seen in two other patients. As you can see, wherever the shade is darker, you see a more heighted tumor there, and hence which cannot be the height. The three-dimensional structure of the tumor cannot be detected on the conventional fundus photograph. So the distribution of ODM is usually pyramidal, giving the appearance in MCI as that of concentric red circles, which we have given the name as dartboard sign. Now, 4 out of 7 patients showed feathery margins. As you can see, the margins are feathery here of the tumor, along with some satellite lesions that you can see here. So, on OCT, if you see, they represent hyperreflective foci, these satellite lesions that you can see on the MCI. Now, these satellite lesions could also be a melanin dispersion or could be tumor cells. So, histopathological evaluation of this satellite lesions is very important, but they are well delineated on the MCI than on the color fundus photograph. As you can see, because of the enhanced contrast that the MCI provides, you can see these satellite lesions that are present near the feathery margins of the tumor. Now, the third unique feature that we noticed on the MCI was the greenish hue that you can see on the disc. So, on 3D reconstruction, if you see, this represents elevation of the disc at a part where the disc is not involved by the tumor. So, as you can see, the greenish hue that you can see on the MCI is basically disc edema. Disc edema cannot be recorded on conventional fundus photograph. Yeah, some may argue that the margin is slightly blurred here, but the amount of elevation can only be recognized on a stereoscopic examination, which can be recognized by the greenish hue that we see on the MCI. One of the cases, a 50-year-old female patient, best corrected visual acuity was good, 20 by 20, demonstrated a mild to moderately pigmented optic disc melanocytoma. We were not sure whether this is a retinal involvement or a choroidal involvement, but the infrared reflectance image as well as the MCI showed a yellowish hue in the peripapillary area. And upon doing the OCT, it confirmed that the tumor had more of a choroidal involvement than the overlying retinal involvement. So the importance of this as an early sign of spread or a malignant transformation needs to be evaluated further, and the patient needs to be followed up more frequently than a patient with clear margins. So this study done by C. Mazzini et al. Described the features of ODM on multicolor imaging, OCT, and Octa. So they basically described how the ODM looks on a multicolor image, that is total autofluorescence on the blue light reflectance and well-defined margin on infrared reflectance. The composite image shows a reddish brown lesion with well-defined margins. So our study is a unique study which compares the appearance of optic nerve head melanocytoma on MCI versus the conventional fundus photograph. So MCI basically acquires three reflectance images using three laser lights, and that helps in demonstrating the lesion at variable depths of the retina and the choroid, and hence gives a better contrasted image. And the unique features that we described, that is the satellite lesions, the greenish hue that is seen on the disc due to disc edema, and the depth or the height of the tumor that is demonstrated by the intensity of the redness that you see on the MCI. And hence MCI is definitely better than conventional fundus photograph, and whenever possible and if possible should be brought into the clinical practice as a routine means to follow up the patients of optic disc melanocytoma. Thank you.
Thank you, Doctor. Contemplate comparing this with the optic disc hemorrhage of the same size.
Optic disc hemorrhage?
Yes.
Uh, as in the MCI image of an optic disc hemorrhage?
Yes. Because there also you'll see an elevation. You may see a similarity in the colors.
Yes, ma'am.
So
but we also
if you
compared.
had a comparison, it would have been,
Yeah.
better to show.
Right.
That would have been a good comparison.
Okay. Right.
What equipment have you used to take MCI image?
Spectralis machine, Heidelberg Spectralis.
Okay, that's which gives that all.
Yes, ma'am. So an OCT scan with the MCI. So MCI OCT can be constructed into a 3D image. So you can reconstruct the 3D images on that.
So what other diseases do the MCI is beneficial? Just I'm asking.
So they are more beneficial for AMDs. So to determine the geographic atrophies and the involvement areas. So that is one of the places where MCI is gaining importance. Apart from that, ma'am, any melanin tumor is very well recorded on infrared reflectance of MCI. Previously, IRAF was used for melanoid tumors, but the resolution that the IRAF provides is very less compared to the MCI. That is the IR reflectance image obtained on the MCI.
And how frequently do you follow up these patients with melanocytoma?
Sir, we have a protocol of following up 3 monthly for the first year, and then if the tumor remains stable, then 6 monthly, sir.